It is indeed a pleasure and an honor for me to share this very auspicious occasion, which I believe is the first ever National World Oral Health Day celebrations in Fiji. So I'd like to congratulate the association, all the oral health workers in Fiji for the tremendous job that you do. We value your contributions in ensuring that our Fijian people have beautiful and healthy teeth. And the MC said the theme, again, I'm not going to ask you to say that. When you say think about mouth and think about health. So I believe when you go back, that is the theme that you will take back to your schools, to your organizations, to your communities and to your families, and promote healthy teeth for good health. So first of all, let me thank you, express my thanks to all those who participated in the march. And I believe preparations had been ongoing for a long time. And thank you very much for being here and supporting the World Oral Health Day. Ladies and gentlemen, World Oral Health Day was initially declared in 2007 and originally celebrated on 12th September as aligned with the birth date of FDI, that's the Federation Dentaire International, and the founder, Dr. Charles Gordon. However, this campaign was not fully activated until 2013, and the date was changed to 20th March to avoid conflict with the FDI Congress taking place in September. And I believe that the new date that was chosen was indeed perfect. It reflects that seniors must have a total of 20 natural teeth at the end of their life to be considered healthy. Maybe it's time for us to check how many teeth we have, silently of course. Children should possess 20 baby teeth, and healthy adults must have a total of 32 teeth and 0 dental cavities. Again, something for us to reflect. What is it that we have? Do we still have 32 teeth with no dental cavities, or we need our teeth and mouth needs a lot of attention? So expressed on a numerical basis, this can be translated as 320, hence March 20th is recognized as the World Oral Health Day. And I'm pleased to say that Fiji's national celebration is aligned with the international theme that we have been told, say, think mouth and think health. I mean, sometimes when we talk, we don't want to open our mouths wide. Maybe we are trying to hide some teeth that is not too good. But we should always look after our teeth. I believe that's very important. Indeed, ladies and gentlemen, the theme empowers individuals to keep a healthy mouth and helps you maintain your general health and well-being. And I believe oral health is much more than a nice and a beautiful smile. Oral diseases, I'm sure you know, can impact every aspect of life, from personal relationships and self-confidence to school, to work, or even enjoying a simple meal. Teeth are really important. Ladies and gentlemen, this event is really to intensify public awareness on oral health, and that unhealthy diets, particularly high in sugar, tobacco use, and harmful use of alcohol are common risk factors contributing to oral diseases and other diseases as well. Awareness of this magnitude is indeed a great opportunity to increase our reach out and awareness to promote good oral health practices at family level through national level awareness activities, and of course accessing or allowing people to access information that they need to understand the need for them to take care of their teeth. According to the National Health Survey conducted in 2004, 88.3% of 6-year-olds had signs of cavities involving their primary teeth, and 85.2% had primary teeth and untreated cavities, while 49.1% had 4 or more decayed decayed primary teeth. So in view of the above, the oral health professionals of the Ministry of Health and Medical Services have emphasized on the importance of maintaining good oral health practices that is envisioned to last a lifetime. Ladies and gentlemen, the National Oral Health Survey is forecasted to be conducted at the end of this year, whereby we will be able to evaluate the outcomes of all oral health promotion programs and enhance our strategies for the development of new health programs in Fiji. And this we will achieve through promoting good oral hygiene in all dental settings, whether it is in private clinics, the Fiji National University, or our community outreach or any government department clinic. The ministry's oral health program addresses all cohort groups within the wellness matrix from the womb to the old age, commencing with, if I can mention some, antenatal clinic guideline for pregnant mothers, inclusion of an oral health component in the maternal child health card, primary school oral health programs for 6 to 12 years, Your Smiles Matter for adolescents from 13 to 19-year-olds, community oral health care package for 20 to 60-year-olds, specialized outreach programs for elderlies over 60 years of age. So these are some of the work that's in progress. The Oral Health Department is the first department within the Ministry of Health to have designed health promotion programs for each of the above-mentioned groups within our wellness matrix. Congratulations. Ladies and gentlemen, I'm pleased to say while the Ministry has been having the World Oral Health Day awareness, the celebrations in the respective clinics or subdivisions over a decade now, this year, the health team has been able to confidently take it to the national level. This, of course, has been achieved through our strengthened collaboration with the oral health institutions and our stakeholders present here today. We thank you all for the sincere work and commitment that you have done, and I wish and hope that this commitment will continue to help us achieve our health targets. Ladies and gentlemen, nurturing a multi-sectorial approach within health departments, government ministries, NGOs, the private sector, and the professional organization is very much essential to tackle the non-communicable and communicable diseases that we always hear of. As such, I would like to put on record my sincere appreciation to all our oral health staff in recognizing their profession, and we are very much pleased with the ongoing support provided by the Oral Health Professionals Associations and institutions in raising awareness on oral health in Fiji. I'd also like to thank our corporate organizations such as Colgate for their tremendous support in promoting oral health programs such as Mum You First, the Oral Health Month, and the celebrations of National Toothbrushing Day, which saw Fiji committing more than 233,000 participants last year, and this being the highest coverage percentage worldwide. And I'm sure we will continue to work with Colgate, and we do appreciate your partnership in this very, very essential and crucial matter. So thank you very much, Colgate. To the students, parents, and families present here today, I encourage you to utilize the information booths, and also to the public to utilize the information booths displayed here and speak to oral health professionals to know more about our oral health programs and how to care for our teeth. I urge you to utilize this time to gather as much information as possible regarding the field of dentistry and its importance in saving the community. I'd also like to urge students to take up these courses and this career path. It's very important. I'm sure the oral health workforce is in need of new and innovative graduates to join that. So please take this up as a career path. For students, you are needed to be part of this oral health workforce, and I encourage you to take up career opportunities to assist us in this. Ladies and gentlemen, to all the stakeholders who are today, as we celebrate this first ever World Health Oral Day together, we must be reminded that it is foreseen to be a humble beginning to achieve greater heights for dentistry in Fiji. Achievements that are perceived to be successfully attained through only our collaborative approach. If I may just take some more time to add two issues that we are currently addressing at the ministry level and the national level in terms of two communicable diseases for which we are asking your continued support and assistance. You're all aware that we are dealing with dengue. We are dealing with dengue at a very big scale, and if I may mention some numbers here, we have had a total of 1,854 confirmed cases of dengue from January 1st to March 8th this year. While in the recent weeks, there has been a general downward trend in cases in the northern and the western division, we have noticed an upward trend in the central divisions. We are calling on the general public to be more vigilant, to take heed of the preventative measures advised by the Ministry of Health. We need your support to get rid of all mosquito breeding grounds. In Parliament last week, I mentioned that we have close to, I guess, about 26 mosquitoes that are in Fiji, and only two of two of them are responsible to cause dengue. Now, which one of those bites you, I don't know. We cannot be sure. But what we can do together is to ensure that we destroy all breeding places. You and I, together in our communities, our groups, our families, need to do that. We need to get rid of all the dengue breeding places so that we can protect our families, our communities from dengue fever. So, ladies and gentlemen, even though we've seen downward trends in the Western and the Northern Division, work is still continuing. Our officers are still on the ground, talking to people, reaching out to them, spraying places. And again, I mentioned spraying is not the solution. We don't want to induce a lot of chemicals into our environment. Our environment is a home to many other beautiful and beneficial insects. We don't want to kill them. So we need to clean up our backyards. We really need to do that. And I humbly urge for your support in that. The second subject, ladies and gentlemen, that we have at hand and that needs an urgent awareness is the outbreak of meningitis. Those of you who may not be aware, meningitis is life-threatening. It is caused by a bacteria, but can be treated if detected early. This bacteria, disease bacteria, are not easily transmitted, but are spread from person to person via saliva or spit. This can happen when a person with the bacteria coughs on an uninfected person. It can also be spread if a person shares drinks from the same glass, cup, water bottle, or bowl, including yangona, the below. Okay? Ladies and gentlemen, some of the symptoms of meningitis disease, especially for older children and adults, include sudden fever, vomiting, headache, stiff neck, backache. Other symptoms include nausea, eyes that are sensitive to light, confusion, rash, red or purple spots in the skin. We are going to carry out a mass communication drive on this so that every family, every individual understands that this disease can only be treated at a health facility with an antibiotic medication, medicines that kill bacteria in the body, specifically used for this disease. Anyone can get meningitis. So the simple advice here is cover your mouth when you cough. That's a simple thing, like destroy mosquito breeding places. In this case, you need to cover your mouth when you cough. However, babies, children, teenagers, and young adults are most at the risk of getting this disease. People who have certain other medical conditions that weakens the immune system are also at an increased risk. Therefore, ladies and gentlemen, this is a deadly disease, and we all need to be vigilant. When presented with the signs and symptoms that I've just mentioned, please seek immediate attention. That's very important. More information will be released by the ministry through media releases today, while our facilities, all the other facilities that exist around the country will be having their own awareness programs to ensure that we reach down to every individual. So students who are present here today, please take this message back home. To all the stakeholders who are present here, please take it back to your organization and see how best you can join hands with us to ensure that we really ensure that our people seek medical attention when confronted with the signs and symptoms of this deadly disease. So ladies and gentlemen, congratulations once again for organizing such a wonderful celebration at national levels. Thank you all for your participants. Like I said, to the oral health workers and the association, thank you very much. To the students, thank you very much. You are our ambassadors for good health, and I'm sure you'll take this message back to your schools. And we once again, from a government level, from a ministry level, we once again pledge for your continued support in terms of addressing our communicable diseases, at the moment, dengue and meningitis, because we cannot tackle it alone. We need you, we need your families, we need your communities to take responsibility. We all need to be vigilant and take heed of the preventative measures to seek early intervention to ensure our families are protected from this deadly disease. With these words, ladies and gentlemen, I wish you all the very best for the rest of the program. And thank you very much, and God bless you all.